Good day. In this video, we'll talk about the 10 most deadly diseases in 2023. All of these diseases, whether they have been around for a long time or are new, have had a major effect on people's health. Come with us as we investigate the origins of the world's 10 worst diseases and the measures taken to combat and cure them. Starting with number 10, we have cirrhosis. Cirrhosis scars the liver, impairing its function. Chronic alcoholism, hepatitis B or C, or non-alcoholic fatty liver disease cause it. Cirrhosis was initially described in the 19th century, but its causes and processes were not recognized until much later. Cirrhosis occurs when scar tissue replaces healthy liver cells, blocking blood flow and impairing liver function. Alcohol, viruses, and metabolic diseases trigger this scarring. Avoiding alcohol, hepatitis B and C, and non-alcoholic fatty liver disease may prevent cirrhosis. Cirrhosis risk may be reduced by exercising and eating well. If you're at high risk for cirrhosis, have frequent checkups and watch for liver damage signs.
So cirrhosis of liver is not a curable disease, but it is definitely a treatable disease. The damage done to the liver with cirrhosis is usually not reversible. However, if the disease is identified early in the course of the disease and the adequate treatment is started for the initiating agent, we can always prevent the progression of the disease and rarely reverse it to some extent.
On number 9, we have tuberculosis. Tuberculosis, TB, is a bacterial illness that mostly affects the lungs but may potentially spread elsewhere. Coughing, sneezing, or talking spreads it. The world's worst infectious illness, TB, was originally recognized in the early 19th century. Antibiotics and better treatment have reduced TB infections and fatalities in many nations. On number 8, we have diarrhea, which causes dehydration. Untreated electrolyte imbalance and fluid loss may create major health issues. Dehydration from diarrheal disorders was first researched in the 19th century. Diarrhea occurs when the digestive tract is inflamed and expels feces too rapidly, causing fluid loss. Diarrheal illnesses may cause dehydration if a person doesn't drink water or consume water-containing meals. Drink lots of fluids such as water, oral rehydration treatments, clear broths, frozen water or ice pops, or fruit juices to avoid diarrheal dehydration, except apple and pear juice. Avoid alcohol, coffee, and dairy to prevent diarrhea. For severe diarrhea and dehydration, medical treatment may be needed.
Or if you have diarrhea and have recently traveled. The traveling diarrhea and traveler's diarrhea from going to third world countries can be bad. You just don't know if it's a virus, a bacteria, or a parasite, but your physician should be able to help you.
On number 7, we have Alzheimer's disease. Impairs memory, thinking, and behavior. It causes most dementia, a generic term for mental deterioration severe enough to interfere with everyday living. Vascular, Lewy body, and frontotemporal dementia are other dementias. German scientist Alois Alzheimer described Alzheimer's disease in 1906. It was only identified as a medical problem in the later part of the 20th century. Genetic, environmental, and behavioral factors may cause Alzheimer's disease. Brain cells die due to aberrant protein accumulation. Alzheimer's disease has no cure, however it may be managed and slowed. Maintaining a healthy lifestyle, including eating well, exercising, and socializing, may lower the risk of Alzheimer's and other dementias. Reading, solving puzzles, and acquiring new skills may also reduce risk.
Talk to your doctors, talk to your healthcare providers, and get it checked out.
On number 6, we have diabetes mellitus is a chronic metabolic disorder characterized by high blood sugar levels due to a lack of insulin production or ineffective use of insulin, traced back to the ancient Egyptians, Greeks, and Indians, but the disease was first formally recognized and named by the Greek physician Aretius of Cappadocia in the 1st century AD. On number 5, we have trachea, bronchus, and lung cancers. Respiratory malignancies include trachea, bronchus, and lung. Lung, bronchial, and tracheal cancers arise in the lungs, bronchi, and windpipe, respectively. Lung cancer was first described in early Egyptian times, although it was not commonly recognized until the late 19th and early 20th centuries. Smoking, air pollution, occupational exposure, and family history may cause trachea, bronchus, and lung cancers. To prevent trachea, bronchus, and lung cancers, avoid or stop smoking, minimize exposure to air pollution and hazardous chemicals, eat well and exercise, and obtain frequent checkups and screenings if you are at high risk.
Stage 4 lung cancer is the one which has spread to other parts of the body and it has caused fluid in the pleural cavity. So we call this pleural effusion. These patients are not curable, but we can give treatment which can improve their quality of life and the survival.
On number 4, we have COPD, a progressive lung condition, makes breathing difficult. It's chronic bronchitis and emphysema. COPD was initially documented in the 16th century, but its causes and development were not completely recognized until the 20th. On number 3, we have lower respiratory infections include the lungs, bronchi, and bronchioles, pneumonia, bronchitis, and bronchiolitis. Pneumonia has been described since antiquity. On number 2, we have stroke. A stroke interrupts cerebral blood flow, causing brain function loss. Stroke was initially described as apoplexy in ancient Greece. When a brain blood artery bursts or a clot blocks blood flow, a stroke develops. Smoking, high blood pressure, diabetes, heart disease, and bad lifestyles increase stroke risk. Managing chronic medical issues, eating a balanced diet, exercising regularly, and not smoking may help prevent stroke. On number 1, we have coronary artery disease. Coronary artery disease, CAD, occurs when plaque narrows or blocks the arteries that carry blood to the heart muscle, limiting blood flow and causing chest discomfort, heart attack, or heart disease. Since the 1950s, CAD has been extensively acknowledged and researched. High blood pressure, high cholesterol, smoking, obesity, and a sedentary lifestyle lead to CAD over time. To avoid CAD, eat a balanced diet, exercise regularly, stop smoking, manage stress, and moderate risk factors including high blood pressure and cholesterol. Regular medical visits may detect and treat the disease early. Conclusion: some diseases have increased mortality, but severe diseases have decreased. For many causes, age-related diseases such as coronary artery disease, stroke, and heart disease are increasingly common as lifespans increase. However, many of the disorders on this list are preventable and treatable, and as medical knowledge progresses and awareness of prevention rises, we may see improved results. Eating wisely, living healthy, and exercising regularly can lower your risk of certain diseases. Reduce alcohol and smoking if necessary. Hand hygiene can prevent bacterial and viral infections. If you liked the video and want more on similar topics, please like, comment, and subscribe. Next time, beware.